This is part three of three pieces to the discussion with Allison Dupont about Olmstead planning and the infrastructure and resources that'll be needed to do a really good job with this. I'm Annette Bourbonniere from Nothing Without Us, Stories and Discussions of Meaningful Inclusion. Allison, it's good to have you back. Let's wrap this up. Thanks so much. I think we are severely undervalued. I think that, people don't realize that if you let us live lives, don't take away the benefits we need to survive, because you're going to have to pay for those benefits whether we're working or not. Let us live, earn a living, and move forward, because in the end, that benefits everybody. Instead of looking at us as a cost, look at us as an investment. If we're working, we're paying taxes, we're buying goods and services. This is basic Econ 101. If we're doing that, then other people are, if we're buying goods and services, other people are working and they're paying taxes and buying goods and services, and more people, it's a multiplier effect. So what the purpose is of restricting our ability to do that has long, you've got to take us out of the cost burden column and put us in the investment column. Value us for what we can do, and allow us, open up the channels, open up the roads, give us, what is it, Waymo, is it in use in some states where it's transportation, it's driverless transportation. It's like calling a taxi without without a driver. But when you think about what that would open up for a community like Rhode Island, especially if it included some accessible vans in the fleet, okay, which would be huge. We wouldn't be tied to schedules, could go out at night, go party. I mean, after all, if we're going to work hard, we should play hard as well. Those kinds of things, let's, not restrict us. And I think that's what I'm feeling mostly, is their whole goal of restricting.
Um, I don't think personally that there's a nefarious plot to be restricting. Unfortunately, some of the realities of our disability service system are that it is Medicaid based. It's a medical model. That's how everything is funded. And there are restrictions that come right down from Washington on what we can do within the bounds of that system. Is
Oh,
it the right system? No, it's probably not the right system. But I've always looked at things from the perspective of, here's the ideal, but here's where we're at, and how do we address where we're at? The best path forward that I can see for where we're at now is, you mentioned, is EOHHS the best party to be overseeing the development of an Olmstead plan? How does this work? We can debate who would be best to oversee it, but the reality is that is who's running the bus. So the best path forward, as I see it, as OSL sees it, is to work to build those bridges between our stakeholders, between individuals with disabilities and EOHHS, and understand through communication and collaboration how we can best work together to get the most done.
well, I agree, and I know that the federal policies have a lot to do with it. However, not all the states go through what we do. We have not done a very good job of managing the federal policies. We leave a lot of federal money on the table by restricting what's available, and we overregulate what we do. Rhode Island has probably got the most overregulation of those policies that I've ever seen. And I have, because of the work I do on the national level, I've seen a lot of really good policies put out that Rhode Island would just never adopt, because they just don't see it, and they don't see us as a value. And if we ever did anything, if we can make it clear to them that we are of value to them. And that whole thing, I'm telling you, it disheartened me so much. I wrote a big op-ed piece on it when it happened too, telling them they should all lose their jobs and go work for the corporate greedy companies because they can't get their priorities are so messed up. They should not be worried about keeping costs down. If you keep costs down, you leave federal money on the table. Do the job and reach out for the federal money that somebody else leaves on the table, and you can. It does not have to be as restricted. Our goal should not be to be lower cost than the median. We need to be saying the best services above the median. And it should not be focused just on that cost. So it takes them more than a year to develop regulations whenever they improve anything. And then they overregulate it so much people are scared to take advantage of it. And that's disheartening.
It's not a perfect system. I'm not going to
No.
agree with you there. It's not a perfect system. Rhode Island started having one of the more infamous state institutions in the country. Rhode Island started out very ahead of the game, and we have catching up to do. I don't think anyone at the state will deny the fact that we have catching up to do. Rhode Island is the only state without the only one of only 5 states without an Olmstead plan, and the only quote unquote blue state without an Olmstead plan. The state is motivated, for whatever reasons, the state is motivated to develop a plan. And part of that plan is going to be figuring out what can be funded. We are not numbers. And it's important that we're not identified as numbers or price tags. Being one of the people like yourself that comes with a higher price tag, I am fully behind this concept. I have a lot of medical needs, and I rely heavily on support services to be functional, and to be successful, socially, in terms of day-to-day life, and professionally. But I do see hints that the tides are shifting relating to public sentiment for people with disabilities. I think the Ticket to Work program, the Rhode Island one, not the Social Security one, which is a whole separate conversation we won't get into, is definitely a cue in the right direction. And I think it's a real case for the power of advocacy and our ability to share experiences and bring legislators around to the idea, to concepts. For the Ticket to Work program is the new Olmstead Sherlock plan for people under 65. Yeah.
Under 65, yeah.
Yeah, people under 65 who are
By the way, I
working.
fought for it to be that, I fought for the original Sherlock plan to be the one that is under Olmstead.
Yes.
But
And
they wanted to make sure I worked until I died because I'm past the 65, so I'm never going to benefit from.
Well, and people over 65 will be the next frontier that fight goes to. But now people like myself who are working, younger professionals, have the ability to save and receive services without losing our essential Medicaid benefits in a way that we didn't before. I can have a retirement now. I can have bank accounts other than an ABLE account where I can save money for a house, for a car, whatever. And it is worth noting that legislation was initially dead in committee, and it was the advocacy work of individuals like myself, yourself, and a number of other people who went to legislators and helped them understand that this wasn't an added cost. It was a savings. It was a value added
Right.
budget positive motion.
Yeah.
Um, that legislators were under the false idea that
Yeah.
if that someone like you or myself, if we were earning more than the limit, would go off the services and earn the limit, where the reality is we do whatever we have to do to retain those benefits because we can't live without them and there is no other source. And it
Right.
took some work, but they got the message and we were able to alter their thinking. And I'm positive that if we continue to come together and push those messages and share our experiences and reach those people, we can continue moving things in the right direction.
Well, I'm with you on that. I hope that you're right. I do, and I must have enough hope that I do keep on fighting.
Mhm.
Um, they have to realize that there are people with real capabilities. Look at yourself and myself and a whole bunch of other people. I could list many because of the work I've done. I've met many of them. They're, educated, motivated, and quite capable. And it's, I mean, even some people without the education are motivated and do other things. Remove the barriers, and there's a chance for us to go anywhere.
Mhm.
Um, so you've kind of lightened my heart a bit with this discussion. I'm not really hopeful, but let's see. Um, let's see what can happen. Um, like I say, I've been doing it a long time, and maybe I'm just beaten up by now. But if I chipped away enough room for something to get through, I'll be happy. So, but anyway, so I do thank you for this discussion. It's really been helpful. I hope people can see, uh, what is going on and what, really needs to happen. I'm really glad you came and I'm really grateful for your input. People need to hear all sides of the question. If we're not proactive, you know, we're not going to ever succeed. So we have to be proactive in Olmstead and other areas. So thank you for listening. I'm Annette Bourbonniere from Nothing Without Us, Stories and Discussions of Meaningful Inclusion. Please drop us a like and give us your comments. Please subscribe. I'm trying to make this podcast grow. There are free subscriptions, although there are some benefits to the paid subscriptions. But either way, I would like to have 1,000 subscribers by March 31st. Please help make that happen. Tell your friends. They can find us on Patreon, YouTube, Spotify, and other favorite audio platforms. You can find me on LinkedIn, Instagram, and Threads, and Blue Sky. By the way, that's a pretty good format. I like it. So until the next Nothing Without Us, I'm Annette Bourbonniere.